Good morning and happy April Fool's Day. Happy April and spring. It's Lily in Scotland's Wild Medicine, and I'm delighted to have Kirsty Miller with us today. Kirsty, thank you so much for coming on the podcast.
Thank you for inviting
me. So you've been making news. Let me just make sure that this is going off there. Yeah, you've been making news. For those of you who have never met you, was it the TikTok video that really kicked everything off for you?
It was, Lilia, yes. Well, do you know, it never went on TikTok to start with. I put it on Facebook to say, come on, you know, nurses, doctors, allied health professionals, please speak out. This is what's happening. Because obviously Scotland was the first for a lot of things in regards to the pandemic. Mm-hmm. Put my video out. I think it lasted maybe 11 hours or not even that long, and then I got shut down. I lost my account and everything.
Oh, really?
Yeah, for like
when
9 months.
That?
On Facebook.
What month and year?
Oh, March the 27th, 2021. So it's 3 years this week that I actually left my career.
Right, okay. So can you just talk us through that? For people that don't know your name, can you just talk us through what happened, how you felt?
Okay, so I was an acute medical nurse. I've worked in different areas in Scotland. Latterly, it was acute medicine and the bank. So just, 2020, I was a charge nurse in a care home, and all these guidelines and protocols started coming from the government. So as a charge nurse, obviously, I'm in charge of a team of staff. And on shift, I would be the only clinical professional. So a lot of things didn't sit well with me. And I'll tell you why, because I had coronavirus in 2017.
Wow.
Yeah. One of my patients was admitted from Nine Wells into a little county hospital on New Year's Eve. And she was extremely unwell. At 2 o'clock in the morning, 94-year-old lady was transferred. It was horrific, and myself and the charge nurse wasn't happy, but we got her all sorted, and that next day I ended up feeling really unwell. Went to the doctor on, I think it was the 3rd or the 4th of January, and I had to have a swab test, and it was confirmed that I had coronavirus. Well, Kirsty, you don't do nothing for a coronavirus. Go home, but you have got influenza B, so we'll give you Tamiflu. So I had coronavirus. So when this started coming out in 2020, I was like, what's going on here? You know? And I'd done a wee secondment in the Lorne Isles Hospital in Oban for a year. So I worked in Ward B in the acute medical ward there. And this was in 2019, and we had government workers coming in who were testing us to make sure that we had the right PPE in case anything kicked off, you know. And I started asking questions. I was like, what do you mean if anything kicked off? This was November 2019, sorry. Mm-hmm. You know, and in that period of time, as I'm traveling from like Oban back over to the East Coast, I'm seeing all these signals saying no to 5G. You'll see them in Dalmally and things, and I'm going, what does all this mean? Of course you would want like 5G and things. That'll be fantastic for the world, because I'm none the wiser, you know. So all this started happening, and what happened was my daughter didn't settle in Oban, and we had to move back to the East Coast. So 2020, I became a charge nurse in the care home. Protocols and guidelines started getting rained down by the government. I started watching the TV, and I seen that the hospital, like the care homes in Spain and places, you know, with all the carers running out, and like they were leaving the residents in there to die. That's what we've seen on the news. And I was like, bloody hell, what is going on here? And I was like, that's not happening here. And we all everyone got locked down. We got special letters that in case we got stopped by the police to state that we were a health professional, and, you know, that we had the right to be out on the streets. Still nothing. Our residents were absolutely fine. What started happening was that we were getting told that they weren't allowed out in the communal area, you know, like in the sitting rooms and things, and that we had to lock our residents in the rooms. They had to eat and drink in the rooms. And I'm like, it was so emotional, because these on the bottom floor we had residents with cognitive behaviour disorders like dementia and Alzheimer's and things, you know, and it didn't make sense because there was no virus there. There was not, it wasn't happening, you know. And then we got told, like, so my concern was that the manager said to us, no COVID, no PPE. Okay, so if none of our residents had any COVID, we went to get PPE. It was locked in their office.
What?
Yeah, this honestly, yeah, it was locked in the office. So we had to. There were schools that started making visors and everything, like in Broughty Ferry. So we, as health professionals and the carers, we had to go and buy them because the care homes were refusing to give us them. You know, and I'm still like on the edge, going, what the hell's going on here? Something is not right, you know. And then they started speaking about like making big mortuaries. So do you remember that? So they started speaking about making big mortuaries. So on our way home, because I was driving, so I'm dropping off the carers to their homes like after night shift. And I'm going, right, we're going up by the ice factory to see if there's mortuaries happening, because we're not, what's happening in all the other care homes, because nothing's happening here, you know. But all that's happening is that our residents are declining cognitively. They're not allowed to see their relatives, you know. And actually, latterly, what happened was the kitchen got locked on night shift so that we couldn't give them any food.
Oh my God.
Yeah. And then the doctors, the GPs weren't coming in to assess the patients, you know. So we're putting in, like, obviously reports of concern in regards to some of I say patients and I say residents because I've worked in the hospital and in the community sector. So the doctors were refusing to come in. There were residents declining, and they weren't declining because of any virus. It's because they were prescribed medication and they were having a reaction to it. And I would just score it. I would score it as I'm not giving it, because some of these residents were cognitively intact. You know, they were cognitive, they knew their mind, they had MS, they didn't have dementia. So they know their signs and symptoms, they know when their body was changing, but they knew that they were in pain and they needed something. The medication wasn't helping. I was told to basically shut my mouth, know my place, and do as I'm told.
Oh my God.
That's what happened. So I decided that I would start writing reports and taking note of everything that was said and done. And I soon left and went back into the NHS. I did report the manager for her part in it, because at that, you know, you have friends and you have friends in the NHS and your work and your colleagues and all that, but you actually have a duty of care first and foremost to your residents and your patients. So I reported to the NMC and I reported everywhere that I possibly could. Sadly, she got struck off last year for her.
Really? Okay. So action is getting taken.
Yeah.
Wow. I didn't realise that.
And it's a shame because actually I tried to say to her and I was told to just stay in my lane, you know. But my lane was obviously as an advocate for these vulnerable patients and residents.
Absolutely.
So she got struck off.
It's just so hard to believe that happened. I mean, we know what happened, but I think for most normal people, it's really difficult to believe that when you're at your most vulnerable, in the most allegedly caring profession, that could happen.
Yeah.
I mean, it really makes me feel so sad even just hearing you talking about that. Because
it brings up for me as well, because I don't really talk about it anymore. So
my mum died a couple of months into the first lockdown, and we managed to keep her at home. And we're from a big family. We had a full-time carer. You know, we were very lucky. I know that very few people were in the position we were in. And it's still one of the most challenging times. But what I do know with the drugs is you're choosing. We were choosing for her, which never felt right for me. Like opening her mouth and me putting things in that she hadn't cognitively agreed to, because I'm very much like my mum. She wouldn't have wanted anything like that, but also she had a lot of anxiety. She had sort of dementia, and she was a fall risk. So you're making these decisions. It is so, I could feel it in my body.
Yeah.
That's
energy, isn't it?
Absolutely. Like putting things into people just without any thought about what it's going to do to them. It's just crazy.
Well, Lily, I had still no idea really about what big pharma was all about. I mean, I left that. I was actually working on the bank when I was a charge nurse, because, believe it or not, nurses don't get a lot of money anyway, so you're having to top up your shifts, So I managed to secure a placement back in Nine Wells Hospital, where I trained and studied, and actually done a 3rd year placement there. And so I went back into acute medicine, and I went from the care home into acute medicine, and then I'd already been working in the bank in the little hospitals like Perth and Arbroath and things like that. And I was like, what is going on here? I mean, there's signage on the floor. Stand this way, go on this lift, 6 people in it, only allowed 6 people in, in like the treatment room. And I'm like, in every ward I went into, it was different. Like it was all different. And I'm like, what is really, and I never once done a PCR test.
Mm-hmm.
Never once. And for some reason, I did not understand why it didn't feel right for me to actually do a PCR test. I just didn't want to do it, and I used to pass it over to my colleagues. I couldn't until I started obviously research, and I was like, whoa. And actually, we had 2 patients in, and sadly one passed away in A&E, because one of the nurses, at the start, spoke out with 2 other nurses, and one of them worked in A&E in Nine Wells. And she would confirm this as well. But we had 2 elderly patients who actually died of hematomas, brain injury, because of PCR testing.
Well, like you, I never took it either, because I just knew, and it was very difficult, I think, for a lot of, maybe women tend to tune into that kind of stuff. And that's a bit of a gross generalisation, because I know a lot of men did too, but and there was something in your water. Something nefarious is going on here. I do not like it. And as you say, the inconsistencies, if you've got any kind of mind for research, they made no sense. And people blindly following, and like you getting told to stay in your lane, don't question. It was like you weren't allowed to question it.
We actually had our names on a clipboard at the top of the ward for everyone to see. And when I would go in on shift, Kirsty, you've not had your C vaccine yet, and I'm like, that's my personal business, And I was able to tell my patients, I now know the power that we all have internally, okay? Because I didn't understand this before, but now that I work in energy medicine, I know as a nurse that when people would walk towards me, I could tell the conditions that they've got. But what was happening when my patients were coming in, I could tell if they had the AZ or the PZ. Do you know what I'm saying?
Wow.
So back then, I knew if it was blood-related cardiac through the AZ or if it was neurological. And this is what I was trying. Yeah, I could tell. But I'm like, right, okay, so where is the paperwork? We've not been trained in how to document this. If this is one of the biggest clinical trials in the whole world that we've been alive and we're nursing, how do we monitor this? Mm-hmm. And then the patients that were coming in, some of them were bleeding from both the orifices. Their eyes they're screaming that their eyes were burning. Their temperatures were down at 34, 35 degrees. They were septic they were cold. Sorry, I'm losing my words there. But we had to get bear huggers in. There was one night, and I thought, wow, okay, so I wonder if all these patients have come from the same area and had the same batch, because they've all got the same symptoms. And you know, one of the consultants was like, Kirsty, you're thinking far too much. Well, come on. Like, why are we not getting to the root cause here? What's happening? This is not normal. I've never seen this. You know, if patients were coming in elderly at that time of year, it's because they've got chest infections, and we would be, you know, we would obviously look after them using our, if it was a septic protocol or antibiotics, whatever. But because of the PCR test, these vulnerable patients were taken from us and put into COVID wards. And then started on regimes, which I've been a researcher. I've been a medical researcher for 24 years. My daughter, I've got 3 children. Shannon's 24, Aidan's 20, and they both have a condition called horizontal gaze palsy with progressive scoliosis. They're the only 2 kids in the UK with it.
Wow.
So they've got spinal rods, visual impairment, and the medulla's not formed properly in the brain. So Shannon has got ADHD, mild learning disabilities. My son has, we think he might have, like, just be on the autistic spectrum a little. But she's trying to get obviously tested now. It's an absolute nightmare. However, we've got our own way of doing things. But this is what was happening, you know, this is what was happening within the wards. And because of my researching abilities, I mean, I would take the research papers that I would find for scoliosis. You know, Shannon's got surgical steel in her spine. Aidan's got titanium rods because of the research that I've done for my children. And I would display it at Edinburgh Sick Kids, and they would be like, Kirsty, oh, you've done your research. It's my baby. That's my babies, of course.
Yes.
You know? So I started researching like the COVID protocols and stuff, and I'm like, whoa, you know, I'm not going to say some of the words because shut. Yeah, but actually it caused the treatment plans caused kidney failure, pulmonary edema, and people are drowning. You know, shuts their heart off and everything. So I started writing emails to all the intensive care units, asking them to look. I did, you know. And the nurses gathered together and we stood for election in 2020. Yeah, we stood for election and tried to get into Parliament.
Good for you. My God, I didn't realise that.
Yeah, there was quite a few. You know, there's my wonderful colleague Jill McGowan. She's absolutely fantastic. Now she's a doctor, and she heals people through doing Buteyko breathing.
Yes.
Yeah, she's done that, and she's trained with me as a silent counselling practitioner. I'm working with a team of specialised nurses and a homeopath who's absolutely fantastic. And we have been actively saving lives because people have been sent home to die from hospital. So all over the world, basically, that we've been supporting people through telemedicine. So it's a wee bit different, you know, it's a wee bit different. And yeah, just with all of that in the hospital, I decided that I had to speak out because I was waiting on somebody more senior. Because who was I used to go home and I'd be like, you know, I was telling you before, it was like this woman was coming to me and she was like, whoa, like, come on, speak out. This is, you know, and now I realise that there's an ancestor or spiritual connections because it really made me step up to realise my qualities or my strengths, you know. But this woman was called Kahina, and actually when I went and spoke at Holyrood, because I was outside with a microphone, absolutely crapping myself, by the way, because public speaking, I was like, oh my God. But I had my Freedom Alliance with the nurses, the team of nurses, and I was like, come on, speak out, please. We need you. We need you to stand up, you know. It was the most terrifying experience of my life, but I know that I had to do it, and I believe that there's this woman called Kahina. She's from the 3rd, 4th century, and she spurs me on. So she was a freedom fighter and a medicine woman from back then. I had no idea because I was like, my family were like, who's Kahina? And I'm like, I don't know. I changed my name on social media and everything. Kahina. You know, I'm like Kahina Silver, like some sort of you know, like you see the Care Bears, the cartoon characters, like, woo! That's what it was like. And that's what I felt inside, because I was like, I've waited long enough for people to speak out. This is my truth, my story, and this is what I'm going to say. And from then on, I've had about 100 accounts, Lilia. I had 250,000 followers on TikTok.
Aye, so they shut you down.
They just shut me down constantly. So that's why I've got Love Conquers All on Facebook, because I thought, wait a minute, something clicked in me. And I was like, Kirsty, you need to stop, because I was sharing all the protocols, I was sharing the white papers, I was sharing all the evidence of like transhumanism, the Agenda 201, all of it, right? I'm sharing all. No, but I didn't realise. I was like, look, I'm not crazy. I'm telling the truth here. And then something clicked inside me that Kirsty, you've been fighting for a year to try and get your voice heard. Change it to love.
Yes.
And that is exactly what I done. And within weeks, my following went up on my Love Conquers All. And something so beautiful changed inside of me. I actually was approached by a lady called Candice Wilson on TikTok, and she said her passion was to tell people about silent counselling. So silent counselling originates from Scotland.
Brilliant.
And I've met John and Marjorie Cooper, who are energy psychologists, and they were trained by Roger Callahan. So you know I know you've got the genius as well, because Stuart told me.
Yes.
Stuart, the holistic dentist. So when I met Marjorie and John, I was at a workshop event that Candice had created, and they came into my workshop, and I was like, oh bloody hell, no pressure, you know. You're sitting there, and I'm like, got this genius, you know, and I'm thinking, this is technology. What they do with their hands is absolutely sensational, you know.
Yes.
But she said to me, Kirsty, do you know that Roger Callahan would be able to tell what was wrong with somebody through the frequencies of their voice when he spoke to them on the phone?
Yes.
And I was like, wow. You know, I said, no, I did not know that, because you know how wonderful the genius is. I mean, I've supported people on their way back to a beautiful life after they've been diagnosed with cancer.
Yes.
And they're doing absolutely fantastic now, you know. It's just absolutely life-changing. So with silent counselling, Candice wanted to tell me about what it is, non-invasive therapy, and you're using, it's rapid energy relief, so it's like partly like EFT on steroids. So you're going to all your meridians, and you're releasing all the toxic build up. So you can go to the PAT, you do muscle testing from kinesiology. So you're doing, you know, you can test from the past, the present, the future. Is it emotional? You can test supplements to see, you can do this yourself.
Yes.
Yeah.
And that's what has to happen. There's too many people sick. We have to empower people and train people.
Absolutely. And that's what I'm doing now, Lilia. So I now train people in silent counselling.
Fantastic. Right. Well, listen, we'll put a link up to that. Now, my brother's been devastated by the vaccine. I think it was AstraZeneca he took, and he has, you know, he's just been disabled, let's say. So what would you recommend for him?
Well, every person is individual. So as much as you see protocols and everything out there, it depends on past medical history. It depends on a lot of, like, there's a lot of factors. So when we're seeing people that have been vaccine injured, you know, we had a lady that had open heart surgery, had 7 injections, and was basically told to go home and die. And now we've got a cardiac nurse specialist on our team, and she's absolutely sensational. She's been nursing for over 40 years. So we came together as a team, and we done a protocol for that lady. So I would be activate charcoal, SAC tea, you know, your vitamin C, your liposomal glutathione, a great multivitamin, but you have to detox first. And we use energy medicine
Mm-hmm.
as a beautiful sort of capsule to, and some of these clients are really scared to actually even tell their story in public, or to even say that they've worked with us using energy medicine or frequency, because it's sort of like shameful in the 3D world. Even though I'm like, we're nurses, so we've got this beautiful transferable knowledge that we've brought over, you know, so we know all the 3D diseases.
Yeah.
Can take them onto a journey. But what I found absolutely fantastic is using the energy medicine, using the silent counselling, and allowing people to open up into that, so come over to that right hand side of the brain, out of the left where it's logic, overthinking, stress constantly. That takes them on a journey. We're all about educating them to heal themselves.
Yeah, well, exactly. Like Dr. Deborah says, we need to train people, not treat them.
Yes.
I think that's absolutely the way ahead. So listen, I'll maybe see if he'll talk to you, actually, because, you know, it's difficult when it's family.
Yeah.
So now, in terms of that, I mean, you have got ovaries the size of a freaking giant for coming out and speaking out. I know it's not easy, and people get triggered. You know, they want to push back. Some people are still hanging on to the old story. This is, you do what you're told. And now that we're saying, well, no, actually, that's, you know, we're moving away on from that. We're not just meat suits. We're phenomenal energy beings, and there's a completely different way to look at that.
Yeah.
Have you been, how's it been for you in terms of pushback and people being, let's say, reactive towards your information?
Yeah, like I said, some people are really sort of, oh God, this is a wee bit nuts. You know, it's a wee bit woo-woo. I've been, it's been said that I'm like a witch. I'm like, thank you very much. That's an amazing compliment. I love that, you know, because we are all actually healers and we've all got that ability. From now, like lately, what I've found is a lot of pushback from the freedom movement, because I do not engage in any more fear. And I realise the importance of our words and how they are like spells. So we're out there and we're constantly going, rah, the government and all this. You know, you are actually making these things happen, what they're putting out in front of you on the news. So very much now what we do is teach about reframing your words, watch what your ears hear, your eyes see, what you're feeling, listen to that, listen to your body, you know. So yeah, I've had a wee bit of resistance in that respect. However, I realise that they're just not ready to hear the information. They're not vibrating on my frequency, and it's absolutely okay.
Yes, exactly.
Just send them love.
And just go and listen to what resonates with you rather than wanting to attack people saying things that are creating a reaction in you. Because it is, I think, you know, I'm trying my best to be mindful. You don't want to scare people that have done certain things. You want to just be like, well, where are we now? And how can we move forward from there? But, you know, some people feel that they've been duped, and that can be very difficult for some people to swallow.
Absolutely. Do you know, I actually got invited, so I put my flyers around the noon, and I got invited to the Drug and Alcohol Cafe to speak to people that work there because they were interested in working with me. Well, when I started telling my story, they were like, right, that's absolutely fantastic, Kirsty, but a lot of them were sick. A lot of them had faced tragedies because they've lost their loved ones. And I'm taking a big breath going, you know, I know what's going on here. And I tried to sort of say in a way that didn't make me look as if I'm crazy, because that's the way that the government have portrayed us, people like us who actually want to take care of our own health and refuse any of their crap, basically. I got invited to the grand opening because I've actually done a 12-week recovery, rainbow recovery program for those that are suffering with addiction. Because I lost my wee brother 8 years ago he died at 25 because of drugs. And then my mum died a year later. So, yeah, a lot of tragedy and things like that. But it makes you stronger. And when I got home, I got an email and they uninvited me.
Really?
Yeah, they uninvited me because, do you know why? Because the drug worker for the government, the chancellor or whoever it was, I don't even pay attention to any of it anymore, but she was coming to cut the ribbon. So they couldn't have me there. And I thought I would have just said, well, let's chat, because we've been trying to chat with them for a long time.
I know. And that's the thing. It's you try to, one of the doctors I trained with in Canada, she went to court for 10 years because she genuinely believed when she brought in the Quest 9 that it was just because they didn't understand it. So she tried to convince them. Mm-hmm. She didn't realise it was like, no, that you were never getting in with that anyway, because it's a threat to the pharmaceutical model. I think that's naively what you do, is you try to say, no, but look, and you're, and especially every single healer that I know, I've just toured the country, I've got coming to the festivals. I would love you to come to one of the festivals.
I will.
It'd be amazing. And yeah, everybody has walked their own journey and usually have gone into the system and found, as we know, with chronic autoimmune, there is nothing there. You can maybe alleviate some symptoms along the way, but generally speaking, you could end up on 30 pills a day and just get more and more and more sick.
And
so
people
popping out of that and going, right, and it's almost like, even with addiction, you need to get that to that dark night of the soul where it's just like, enough.
No.
Some people just won't get there, and that's okay. We're all in our own crazy journey.
Yeah.
But
it all comes back to emotions.
Yes, absolutely.
Emotion. It all comes back to emotions. Now I've had clients who have got hypothyroidism and their adrenal glands are off. They've got issues with their kidneys, reading the blood results. What I always do, because most of my clients are scared to go to the hospital, so I always suggest that, yes, we've got the genius there, and I love it because I encourage them to go and get private blood tests. And, what I've actually suggested, it does always come up, and the genius backs it, and if they've got, hypothyroidism, they've got problems with their thyroid, they've been in a state of fight and flight for 10 plus years probably. And they've just not had the right tools. I know I've suffered from post-traumatic stress and high function anxiety for 15 years.
Me too.
Up until I didn't even know energy medicine existed. I had a tragedy that happened with me, and for 15 years, I look back and I say to people, hurt people. And I'm like, listen, this is what's happened. And every day I kept saying it over. So how was I expecting things to change? I just wanted to be heard.
Yeah.
And now it's a case of, with silent counselling, we hold space, and of course people can talk, but the silence is how we remove the toxins from the body. It's wonderful. I see if we had this, I'm actually studying with Donna Eden just now. I'm doing a course. She's
amazing.
She's absolutely fantastic, and I love it. And she was speaking about doing the figure of 8.
Yes.
And there was nurses that were actually trained in the burns units, and what they would do is for the burns patients is do the figure of 8 around them because it heals the scars.
Yes.
And I'm just in my element.
Well, it's geometry, isn't it? It's shapes. That's the universe is sacred geometry.
Yeah.
And again, it may seem far-fetched to people, but when you understand to me, when you've got an understanding of quantum physics, it all makes complete sense.
Absolutely.
But if you think this is it, the body starts and finishes there,
and
you just drug it and cut bits out of it to fix it without understanding the whole emotional electromagnetic side. And that's really the message that we were teaching at the Goddess gatherings, was like to help people see And, you know, I've got the Biofield Viewer. I don't know if you've seen that yet, which
No.
is incredible software. I'll send you a little link to it because it's really
Yes,
helpful.
please.
Again, I'm pretty sure you're like me. You can sit and talk to somebody and you know exactly what's wrong.
Yeah.
But all of this technology helps to, because we're so used to tests. Look, this is the biofeedback from the Genius, from the Quest 9, from the HRV, and then we make this complete picture, and it helps people to understand that's your body talking, not me, not a therapist.
That's it.
That's what's happening, and here's what you need to do. But then you find this as well, Kirsty. It's really encouraging people with the daily living. That's where the problems start and finish. They can come and have an hour or a couple hours with us, but then there's all the rest of the hours in between. What do we do? And that's where I think we have to get back to our communities. Where I was in Ardrisha yesterday, the community gardens getting started there. It's fab to see. And, you know, cafes and people getting together, whether it's for cold water, whether it's to knit, whether it's to quilt. It's all.
I remember when I was little, it was a community that raised a child.
Yes, absolutely.
And now you're lucky you know your neighbours. I mean, the way that the complete indoctrination, the competition in schools and everything, you know, it's like constantly compete. Like you feel like you have to compete with people to actually unlearn all that and walk side by side with your colleagues, with your neighbours, with your friends. You know, that's something really special, and it does take work.
Yes, absolutely. And that's the price of freedom. Nobody's going to do it for you.
No.
Freedom, you have to do it yourself, and that's the downside. And the reality is there are people right now that know this and don't have the energy to help themselves. And we need to, I believe we need a place where people can come. Because I was even talking to a young guy the other day, and I said, I could do having you in a place for a couple of days and show you things, how you do it and how you manage it over and over and over again. Because it's so obvious when you look in and you're just like, well, let's get you out of fight or flight. And then you'll
absolutely.
You know, and we're turning the Hebridean in Broadford and Skye into a pop-up healing centre for 2 months, January and February. So if you could come and do a silent counselling, that would be amazing.
I would love to do that. Thank you.
That would be amazing. So
I think I'm actually really ready to go out now in the communities. A lot of people wanted me to speak out and speak about saving lives, and I'm like, my head was all over the place, Lilia, because I thought, I don't even trust what I was educated in. So how can I save people's lives? So I went away and studied. I studied natural medicine, so naturopath. I studied obviously energy medicine. I've done spiritual life coach because I was very resistant to that. I'm like, spiritual, what the hell is this about, sort of thing, you know? But it's actually just finding yourself.
But I think it's fantastic that you've got the medical training and understanding and all these. I mean, that's the perfect combination. You know, I don't have any of that. And I know that, you know, people are like, who the hell do you think you are? You know, like, you know better than a doctor. And it's like, well, no, that's not what I'm saying. I'm just saying, since my best friend's
daughter, you should probably do, because we are actually, it's actually true, because what happens when you go through nursing school, you're only allowed to read certain books, you're only allowed on certain websites. It's all complete indoctrination, you know. We were never, ever, ever trained what's inside these vials.
I know, it's crazy.
Ever. And I know that I've got colleagues, I mean, there's a few that have actually committed suicide in Edinburgh, nurses and a doctor, because they've woke up to the realisation. I know it makes me feel, you know, I've got nurses that are in and out of hospital because they just are holding on so tight to their nursing degree and don't want to let go. And what they're doing is making themselves so sick.
I know.
You know?
It's so sad. Well, when my best friend's daughter was diagnosed with leukemia 30 years ago, I watched her go through a bone marrow transplant, and every cell in my body thought, there's got to be a better way than this. And then last year, my friend Shirley, her daughter was diagnosed, and she refused to have a bone marrow transplant. And, you know, that's she's 23.
Wow.
And she sadly lost her fight in November. But I thought, in 30 years, there's nothing else on offer still. What are we doing? This is 2024.
I know.
Why do we not have a phenomenal healing oasis where people can come and access this stuff, get amazing food and get trained.
I know.
Absolute magnificence of this energy system we call the body. And, you know, it doesn't matter how poor you are financially. You just need to have a mind that's open enough to go, what if I was a lot more powerful than I've been led to believe? Because that whole, you know, oh, you can't do it. It's, you know, somebody else has to do it for you. Bullshit.
I know.
And it's people down.
I know.
And it's disempowering them and it's killing their hope. And it's like, no, that's just simply not true. How dare you to somebody?
Belief is massive, and that's what I'm passionate about, letting people see people believe in themselves, because for 15 years I lived a life of trauma in my head with post-traumatic stress and anxiety, not believing in myself. And then all of a sudden, it's not like it's throughout COVID, this is what's changed. It's absolutely changed my life, where I felt people were mocking me. It's something, you know, actually, my mum passed away and we didn't talk. We didn't talk when she passed away. We didn't speak for a lot of years. She actually attacked me in front of my children, but she actually had her own traumas as well, which now I've learned to forgive and let go. But that killed me inside, Lily. How could I just wanted to be heard. That's all. And that's what happened. So for now, what I do is I want people to know and to believe in themselves. I have a lady who I've supported in reversing cancer, and she's worked along with the Western medicine as well. So she's done that. She's been on a protocol from them, and she's found me. She worked with me, and then I think we've worked together for 16 weeks. And she went away to the oncology. She got her scan, and she was like, "Kirsty, they can't find the tumor. Can't find the primary tumor." And I was like, this is amazing. This is absolutely fantastic. So that was a year and a half ago. And this month, she's actually training to become a silent counselling practitioner with me. She went, "I'm following you, Kirsty, because I'm going to live forever."
The thing is, Kirsty, that's exactly what happens. And then you have a story that I know what it's like for you. I've been there. You know, it's a bit like, you know, somebody, a non-heroin addict trying to support a heroin addict.
Yes.
You can, of course you can, but you've never been one.
No,
so
that's it.
Cancer, if you've been told things and you've gone through that fear, then you're in a much stronger position to say, look, I turned it around. I changed things. I released the fear, and look what I'm doing now. It is such an exciting time to be alive. And I think, you know, we've got the pop-up healing centre in Skye, and then we want to open this is from the Heal Scotland, a centre. I'm thinking a day centre, or get some kind of venue where we can just train people.
I feel that as well. I totally feel that. And I think it's fantastic if we come together, you know, and Ayrshire is doing absolutely amazing. And you know, even for home education, it's phenomenal. Absolutely. I mean, you know, one of my colleagues, Linda McClure, she is a nutritional coach, and she's doing absolutely amazing. She's nearly finished more studying. I think we've got to the stage where we're not studying anymore. We've done enough. We need to do service now. You know, that's where it is. And, you know, us all coming together and actually for Scotland.
Absolutely.
It'll be absolutely fantastic.
You know, we can turn this health trajectory round, but it's not going to come from the government. It's certainly not going to come from Big Pharma. It's got to be a groundswell for the people, by the people. And that's going to require a little bit of energy. And that's going to require opening your mind and going, well, what if we could change this? Because we can. We know that. And loads of people know. And as I say, I've just been around the country talking to people that are doing, I love what Cormac Russell says, look at what's strong in your communities. It's already happening. The community gardens are popping up. There's healers, there's cold water swimmers. There's loads of stuff happening. There's an understanding on the trauma, on the ancestral stuff. Now it's a case of, right, because like you, I'm actually just doing a course right now on, it's the kind of upgrade of EMDR. I can't remember what it's called.
Rapid eye movement,
It's the one. It's a slightly more advanced one than that, but anyway, or different one. I'm not saying it's better, because I don't like when people come and say, "Well, I've got a better way to do it."
No.
Another way to do it. But yeah, we've got all the science we need, and we've got Google. We can find all the information. It's time for action, and I cannot thank you enough for your amazing energy and your expertise and your understanding and your ovaries are
Can
absolutely.
I just actually say that, you know, one of my colleagues, the cardiac nurse, she introduced me to What Doctors Don't Tell You. Have you read that magazine?
Oh yeah, absolutely. Caroline Dean. She lives in Hawaii. I tried to
when I went on, like, I got the first magazine through my door last week.
No, Lynn McTaggart. Sorry, Lynn McTaggart.
That's it. And I opened the magazine and I was like, it's non-chemo protocols. And I was like, you are joking me. The this is what I've been doing.
Yes.
This is doctors that have wrote in this, and this is what I've studied and trained for the past 3 years, been helping people to reduce the inflammation, you know, and actually speak about energy medicine. I was like, oh, hallelujah, this is fantastic.
Yeah. It's definitely, the word is definitely getting out, and it's really about to set the world on fire with unbelievable great news that we have that power to heal.
We have set up our communities on WhatsApp. And it's absolutely amazing.
What's the Silent Counselling website?
So it's my website. It's www.kirstymiller.com. That's
it.
Yeah, that's it.
Yeah. And then people can get you there.
So what we do is we train in the silent counselling. It's a 2-day training course, and level 1 is day 1. Level 2 is when you become the practitioner. It's only 2 days. But what I do, myself and my colleague Liz, who's absolutely amazing, and she's actually writing a book just now, Granny Loch Ness, and it's all about energy medicine for the children.
Fantastic.
So this is what we're doing. And in the communities that we've got on WhatsApp, Liz actually done her first energy medicine Zoom call. So invite people on, mothers, and what we're doing, Liz and I together are doing parent-child counselling.
Liz, has she got a site?
And Nirvana, I'll send you it, Nirvana Medicine. Right, but I'll send you all the links so that you could put them out if you like. And you can come into our community. It's fun. I decided that I wanted to do it this way because I was sick of the restrictions of social media.
Oh, absolutely.
And the people that want to be there will be there, you know. Yes. So Liv done her first class, 9. She lives in Spain. She's from Scotland. She lives in Spain. She's like, come out, Kirsty, we'll have retreats out here, you know. And she's a It's fantastic. But what we're doing with the silent counselling practitioners is continued professional development, because I absolutely believe that code of ethics is so important, probably from the nurse side of me as well, you know, and how we behave and act as practitioners in the community will serve us right. So what we're doing is teaching a wee bit more in depth about energy medicine. We're just away to launch the Soul Mission Collective. So we realise that we're all on a soul mission here, you know. We're going to do a small membership for the practitioners so that they can come in, and we'll do videos and ebooks and things like that to teach them. I've got lots of nurses that have been retraining with me, mental health nurses and general nurses. So
fantastic.
Well, the trajectory. I've actually got 2 doctors as well, which I'm absolutely over the moon with, you know.
Yeah. Oh, brilliant. Oh, I mean, there's so many amazing doctors and nurses out there, and you know, I get it. You've got mortgages to pay, and it can be very challenging to go, oh my God, I can't believe.
Oh, Lily, one of the nurses is actually getting hell for leather. I mean, they are getting put through the ringer in the management, you know, with management, and I think they're trying to push her out. Because actually she educates people on the yellow card scheme, myocarditis, pericarditis. She educates, and one of the patients is actually getting a payout from the government. Mm-hmm. So I don't think that they're very happy.
No, they won't be, of course. But I mean, my brother's like that. He says, I don't care about the money. I just want to get better.
Yeah.
I mean, I just actually got him started in AG1 greens, because at least I know he's getting some nutrition in, and so we just wait and see. I mean, he's then he got better, and then but we know that that's the road, isn't it? Mm-hmm. It's never linear, and it's patience.
And the thing is, we can never actually say that we can cure anybody that's obviously had these sort of injections or anything, because we just don't know, but we can sure as hell try.
Absolutely, we have to try, and we have to help people manage the symptoms, you know, as best we can, and we know we can do that. Listen, I could keep you on here all day. I'm going to send you the dates to the festivals. If you could be in either of them, I would be absolutely over the moon.
That would be amazing. Yes.
Yes, and keep up the good work.
Thank you. You too. You're doing amazing.
Get me in that group, that WhatsApp group.
Well, we've got a free, and it's Activate Your Freedom. And do you know something? For the past 2 years, it's all like Kahina's came to me and it's Activate Your Freedom. Activate. This is all that I've had in my mind, you know. And people are like, Kirsty, you can't say that because you're going to turn people are not going to want to work with you. And over the past sort of few weeks, I'm like, I'm not caring. Activate Your Freedom Clinic. That's it.
Exactly. It's just like we cannot be looking for approval at this stage in the game. It's just not going to happen. You can't please all the people all the time. You absolutely have to just.
I've worked on my spleen energy.
Yeah.
That's what I've been doing, you know. And little did I know that it's all, but like, I know it's about courage and strength and motivation to move forward. And I've lost nearly a stone in weight as well, working with my spleen energy, my stomach, my kidneys.
And speaking your truth.
That's it.
Incredible. So listen, thanks again. And the trajectory change is on. We were going this way and we're now starting to get back.
We're joining you. I know some of you have been aware of the devastation in the world for like 10, 20 years. So some of us are coming along going, we are doing this. And people are like, we've been doing it for ages. Well, I'm like, oh, okay. 3 years ago, it'd be like, okay. But now I'm like, I'm joining you.
Well, we need the alliance. I was talking to a gorgeous young guy, Alan Wilson, last week, and he was like, we need to create an alliance. So that's definitely something where, because I just see Heal Scotland as promoting everybody that's doing incredible stuff. Brilliant. And getting behind people and spreading the word and educating for free. It's got to be accessible for everyone. And I know you'll have to pay for some stuff. We have to pay, overheads.
We're going to be doing like a 3 bracket payment, like Caroline Myers and that do, which is fantastic from America. So they do one. They'll do one video and it's an hour long and it's our education, our time and our energy. So they'll do one for you can either pay £5, £10 or £15 for that video and for that learning experience. But we're leaving it up to the consumer or the person, whatever's in your bank balance, whatever you can afford. And we don't want anyone left behind.
I know, absolutely. That's exactly how I feel as well. I spent 3 days with Caroline Mace up in Fintorn.
Did you?
Oh my God.
Oh wow, that is fantastic. Do you know, I learned about Finhorn 15 years ago, and that's where I first got my SEAC tea from. And that I had childhood eczema, but it was horrific. I was in York Hill Hospital for 2 years, bandaged from head to foot, had eczema all the way up to about 15 years ago. Went to a weight loss class. The man told me about SEAC tea. Within 10 days of taking it, my old skin shed off, and you wouldn't even know that I had eczema, and the liver cleansed the liver.
Brilliant. Yeah, Caroline Mace, she does not miss you and hit the wall. I tell you, she is. If you think I'm direct, this woman just.
I love women like that.
Absolutely.
That's where you have to be.
It's quite difficult to hold my energy hold my attention, but she held my attention for 3 days, and she's hilarious. Well, I thought she was. She's just like, victim consciousness it's over. We've done it. We understand now what all these bad people did, and now it's like, right, where are we going now?
Yes, exactly.
And she's a gift, another real gift, as you are. Listen, thanks a million. And I'll be in touch really soon. Okay.
Thank you very much. Take care.
Cheers, guys. Please like and share this video. Get the word out. You can really help us by sharing and liking and commenting. And if you've got any questions, if you're watching this in replay, Kirsty and I'll keep an eye on it and we'll let you know.